take out these negative beliefs about oneself, and hopefully over time actually get off of psychotropic medications. We have about a 96% success rate of helping people fully mentally recover to the point they no longer need psychotropic meds. The bigger issue I see is, it's a $1 billion business, pharmaceuticals. And if we're talking about something that can actually heal the mind and change someone's mind where they don't need a psychotropic drug, that's $1 billion business. Why am I going to allow for that to happen? I'm going to put every scare tactic out there as possible. And in fact, I think that this is really what happened when the war on drugs came.
Today, we're joined by Jennie Marie Battistin, licensed marriage and family therapist, founder of Hope Therapy Center, and author of Mindfulness for Teens in 10 Minutes a Day. Jennie has spent more than 2 decades helping people recover from trauma, rebuild connection, and found authenticity in their lives. Her work bridges traditional and emerging therapies from EMDR, very interested in that, and mindfulness to psychedelic-assisted treatments, very interesting too. And she's a leading voice on how we can transform trauma into long-term healing. Jennie, thank you for being here today. To start, maybe we can talk a little bit about what originally drew to the trauma recovery work and how your approach has evolved over the years.
Yeah. I think in high school, I had some friends who went through some really traumatic experiences. And I was always that friend, I guess, apparently, that people thought, oh, she listens really well. And so
Mm-hmm.
they would come to me and they would tell me some of these things that they were going through and experiences that were heartbreaking and difficult and challenging. But yet at the same time, I watched as, I kind of held their story with them and then helped them feel empowered to go find the help that they actually needed, that they were actually able to turn their trauma into resilience and become really strong individuals and be able to help others. And so I think in high school, that's really where I began to realize maybe this is something I want to actually learn more about of how to do on the next level, just rather than just being a supportive friend. How can I actually help someone recover trauma?
Interesting. I'm very interested in the EMDR treatment for multiple reasons. I think it's fascinating, just the treatment itself. Two, and I share this all the time, and I think it's my wife and I lost our daughter 8 months ago to like third trimester, and we are very much in the trauma
Yeah.
processing and handling now. And interestingly enough, she started doing EMDR 2 days ago.
Wow.
And she was describing it to me. She's done it before. She's been in therapy for a while. And it's obviously close to my heart because she's going through it and having, you know, having had therapy for the last few years since our loss and all of the things that go with that. I'm very interested in MDR, and maybe you can tell us a little bit about like why it's so effective, what kind of sort of who can benefit from it, what types of traumas you're normally helping people through. Maybe tell us a little bit about that.
Yeah, absolutely. Well, I love EMDR, and I actually do two different techniques. I do EMDR and I do another technique called brain spotting, which are really lovely techniques. And it really helps the neural networks of the brain be able to reprocess information and realize, okay, the trauma's not occurring now. This happened to me, but it doesn't need to be my ongoing story, and I can find freedom from it. And so, what we know about trauma a little bit is there's in our brain an area called the amygdala. And the amygdala is a really important part of our brain because it helps us really quickly discern if information is dangerous or not dangerous. So, when we're
Hmm.
out in the world and we get ready to walk across the street, our amygdala says, wait, is it safe? Can I step across the street? Well, sometimes when we have trauma occur, which is really dangerous and scary, that information almost stays stuck in the amygdala. So anytime there's a stimulus that comes up that reminds our system about that trauma that we experience, it's almost like it reactivates it. So it's like the memories improperly stored in the amygdala. And the amygdala has no logic or reason to it. It's more of an instinctual part of our brain. It's more of the feeling center. And so that's where we get flooded with emotion. So what I love about EMDR and brain spotting is it helps our body remove that information from the amygdala, pass it upwards to our prefrontal cortex of our brain, which is the part of our brain that can help us make sense of information from a more logic understanding base. So we're not recirculating that trauma over and over and over in the amygdala and being reactivated and thinking, oh, I'm in danger, essentially, over and over and over again.
Got it. And what's is brain sporting sort of a subset of EMDR, or is it a different thing together that's complementary?
Yeah, so it's a little bit a subset in a way that the David Grand, who developed brain spotting, was performing EMDR. And if you've ever engaged with EMDR, there's a couple different methods where they usually, like, the practitioner who's using the technique is going to pass their fingers back and forth. You're going to follow their fingers. Well, what he noticed as he was making passes across a certain part, he noticed an individual kept blinking rapidly in that area. So, as most psychologists or therapists who are curious minded, he just simply stopped his hand for a moment. And the person was like, wow, what are you doing? This is like really all of a sudden the emotion got really stronger. And he noticed that they reprocessed that information quickly and differently. And so, what he realized is where we look determines how we feel and how we can process information, which I think it's really fascinating. If you're in a conversation with someone and they're recalling a situation, you might actually catch that they are gazing in different areas. They're maybe looking up towards the ceiling or down towards the ground or way far or way right. Well, it's our body's natural way to find safety or regulation is we can
Hmm.
close our eyes and look. But not only can we find safety and regulation, but when we can find the brain spot where that traumatic experience is located, it allows us to access it, to be able to look at that information differently and reprocess it. So with EMDR, we're doing quick passes and we are probably going across multiple brain spots as we're doing that. But in brain spotting, we're finding the localized area where that information is stored.
Very interesting. And when somebody, I guess let's use my wife's example. She just started specifically dealing with this one specific trauma that we just experienced. What does that journey look like? Is it a lifetime commitment? Is it you get to a certain point, you can kind of, quote, for lack of a better term, go on your own without therapy? What does that look like generally?
Yeah. So for every person, it looks a little bit different. So with either the EMDR modality or the brain spotting modality, for a singular event, I find that I may do somewhere between 2 to 12 sessions, depending on what other thoughts or beliefs about self are wrapped into that trauma. So many times when a trauma occurs, individuals start to, think things about themselves like I am to blame, I should have known better, I am defective, I am bad. So there might be multiple negative beliefs about oneself around that trauma. And so we want to go in and we want to neutralize, in a sense, those negative beliefs so that those no longer are sticky on us and we're not kind of recirculating that over and over in our mind, as well as the actual experience. So I kind of think of it as we reprocess the information, we know that it's happened. We can have a different belief around that where we unhook a negative belief about ourselves in relation to that trauma. And it's kind of like if you were in a museum. I don't know if you've ever been to the Louvre, but I love seeing Mona
Yeah, I
Lisa
have.
because Mona Lisa, when you see her online, you think it's a very big portrait. It's actually a really
Yeah,
small portrait. And when you go in
that's
that
right.
room to see Mona Lisa, you're way far away from it and you can't really see the details of her smile. And as you move through the crowds to slowly get closer to Mona Lisa, you can now see that very interesting smile that she has and the brushstrokes and the uniqueness of that portrait. Well, with trauma, what I think is it's like you've got that stored in the Louvre, but it's at a very far, long hallway. You no longer can see all the brushstrokes and the details. You know it's there. You can see some of the outlines of it, but it no longer impacts you in the same way as when you get up close to the Mona Lisa, you're impacted by the amazingness of this historic, iconic painting. But when you're far away from it, you're not really as affected and touched by it.
Mm. That's a very interesting analogy. I never thought about it that way, but it makes a lot of sense, at least from what I've been talking with my wife and I, both
Mm-hmm.
for this iteration of her EMDR, but previously too. Very interesting. And you mentioned that you're trying, I guess, in summary, you're trying to move those memories from the amygdala to the frontal cortex. And are you trying? I think you said erase the memory, but are you trying to erase it, or are you trying to kind of teach your brain to deal with it, even when it's apparent?
Yeah. I mean, it would be lovely if I had a magic wand and it could actually erase it. Although in brain spotting, I use a little wand. So sometimes it feels like a magic wand, but I really have no magic wand. So I can't take that memory away, but I can help you reprocess it, understand it differently. So again, it doesn't impact you in the same way. So you're able to think about that experience and you're able to put words to it as like, this was a really painful, difficult time in my life. I would not want to have anyone else have to experience the deep pain and the sorrow that was attached in that experience. Yet at the same time, it doesn't feel like it's as a part of me in the same way. It's not as heavy. It doesn't sit on me. It doesn't weigh on me in the same way. Again, I know that it's happened, and that was really hard. And I hope that I don't experience ever again something like that. But I also know that I learned a lot about myself, that I found that I am strong, I'm resilient. I found who my community of supports are. I found new ways to talk to my partner, my friends, my family in a deeper connected way, and to really feel a support in a new way.
So in a way, it's you, at least that's, again, from talking to her and learning from you, it's instead of the trauma running your life, is you kind of keeping it in check and saying, nope, you're not going to take me down this path.
Mm-hmm.
I'm going to tell you when we're going to go down this path under my control, right?
Yes, that's a really great way to describe it for sure.
Got it. And I guess let's go back to the beginning of you working with the MDR. What led you to start Hope Therapy Center? Are you doing EMDR and psychedelic-assisted therapy there at Hope Therapy Center? I know it's a multi-location practice. Tell us a little bit about that if you can.
Yeah, so Hope Therapy Center I founded in 2014. We're in Southern California. I'm in the Burbank area, which, if anyone knows, the television and film industry, there's a lot of studios here in Burbank. So I established my practice here and very quickly grew. By the end of 2018, I had 20 clinicians working for me, and we expanded to a second office location. And then COVID happened. We became very busy and we expanded to another location. And then we combined with a psychiatric practice. And so now we have 7 locations throughout California, 2 in the Northern California area, 4 here around the Southern California area, for Los Angeles and Ventura counties. And so through that, all of my therapists are trained in either EMDR or brain spotting from a trauma recovery standpoint. But also, I love these modalities just even for helping to neutralize negative beliefs about self. You don't have to have big T trauma to work with these modalities. But we really believe in mental health recovery, and our psychiatric team, along with our therapists, works to help people, have happier, healthier lives, well adjusted lives, and to find ways to reauthor the story of their life, take out these negative beliefs about oneself, and hopefully over time actually get off of psychotropic medications. We have about a 96% success rate of helping people fully mentally recover to the point they no longer need psychotropic meds. And we do that through a
That's
combination.
kind of off the charts numbers,
Yeah,
right? I mean, I
absolutely.
don't know much about, but I know roundabout what those numbers are, but that's a huge
Yeah.
improvement rate.
Yeah, it's a huge improvement rate. And we go from a multifaceted approach. We work with naturopaths that are going to look and see how are hormones balanced within your system, whether or not you have any infections or viruses that are causing neuroinflammation of the brain, which we find is a leading cause of individuals suffering from schizophrenia and bipolar disorder. And so we will go in and work with that naturopath to help neutralize viral loads that may be causing neuroinflammation. Along with, we have several different supplements that we work with that help to support brain function and increase dopamine, norepinephrine, and serotonin, which are key neurotransmitters, along with working psychedelic medicine. And the psychedelic medicine really is amazing that we added to the practice really in 2016 is where I became interested in this. Something I never thought I would do, because when I was in grad school, psychedelics were bad. There was the war on drugs, and the psychedelics were in that were bad. But we've actually found that they have been helpful in helping heal the brain.
And in a way, depending on who you ask, they're still bad, right? I mean,
Correct. They're still bad.
it
Yeah.
depends on where you go, and there's still like this a lot of stigma around, you know. Anyway, I want to ask a lot of questions about psychedelics because, and maybe my wife should be on the podcast because this is something she's passionate about too.
Huh?
We're in Colorado, and as you probably know, Colorado is kind of, I guess,
Oh,
paving
yes.
the way for psychedelic treatment. There is a treatment center that opened here in Denver. I think 2 months ago is the first licensed assisted treatment facility in the state of Colorado, maybe in the country, I don't know. But let me ask you about the EMDR and other modalities of therapy. Are you delivering that only in person at your 7 locations in California? Do you also do telehealth? How does that work?
Yeah, so we do telehealth and we do in person. So we have different ways of delivering EMDR. We can either do it by sitting on the video like you and I are doing, and I can pass my fingers back and forth. I can ask someone to do what's called a butterfly tap for EMDR, because when we do EMDR, we're doing bilateral stimulation. So doing a quick butterfly tap can also be an effective way to deliver EMDR. We also have a program where we can actually pull up a little light bar in a sense, where a light's going back and forth quickly across the screen for someone to pass their eyes and follow. And then with brain spotting, like I said, I'm using my little magic wand, which sounds really strange. And people are always like, what are you doing with that? And I said, well, I've always wanted to be a fairy godmother, and now I get to be one. Yeah, but it's really fascinating with EMDR. We can actually find, so what we do is what's called a setup, where we say like, okay, if you could think about this experience that was really, overwhelming, traumatic for you, and just recall that experience. Remember that day, that moment that it happened, where you were. And as you think about that, if you can just notice, where does the tension in your body lie when you think about that experience? Most people are going to have a somatic area in their body. They're going to say, my heart, my gut, my chest, my forehead, my head, And I'm saying, I want you to just notice that tension and just remember the emotions that happened in that experience. And I'm going to just pass this little wand across the screen, and you're just going to follow that for me. And as they follow that, I'm going to find the area. I'll see a little area where they're probably blinking, and that is their brain spot. And it sounds really strange, but I'm just going to actually hold this for like 30 minutes, and they're going to look at this, and their brain is actually going to do all the healing. It's going to be prompted a little bit along the way from me to just notice what they're noticing and to explore different areas around that experience. And so we can simply do brain spotting right here on the video. If we're doing it in person, obviously I'm just sitting there with the person. But either way, both very effectively delivered via video or in person.
Interesting. We have a customer in the Bay Area that started doing, and maybe you know them, it's called Bay Area Therapy Group. They work with Kaiser a lot. Okay. And the founder, John Bieta, was working with a technology company to, maybe I mix this up, but he was creating or trying to create a protocol for EMDR inside of these goggles, these like Google goggles or Apple Vision type. Are you seeing more of that? Is that something you're using? Have you heard of it? Where is that technology going?
Yeah, I've heard of it. I haven't actually had an opportunity to talk to anyone who's effectively deployed it in that way. It's an interesting concept to actually have it within a pair of glasses. I have individuals who have one of the other ways that we do EMDR is with what's called little tappers. So I have a few individuals who have these little wrist tappers that they will wear so that they actually during the day can do a little bit of their own reprocessing. Or if we're doing over video, they could actually use that. So I would imagine with the Google goggles, they're trying to deliver the same thing. It's an interesting concept to actually have that within glasses because it's relatively close to you. I would be curious to see how that works because if we think of EMDR, usually we're using a light bar and we're a certain distance from that
Mhm.
person and we're passing, so they're making big eye sweeps. So I just wonder in the glasses how effective is it would be a short eye sweep, right?
Yeah, I think I tested the Apple Vision a few months ago, and I think, and often I don't know this, but I think that they're able, even though the glasses are closed, they're able to project out far enough where it almost feels like you're
Ah,
12, 20 feet away.
okay.
And it's very immersive, so I assume that that would make it obvious for the very least a very interesting experience, but
Yeah,
it'd be interesting to
fascinating.
see how it evolves over time, right?
Fascinating. I mean, I know they're using VR in a lot of different therapeutic modalities. That there's a few of my colleagues out there that have developed programs that are within the VR headspace and have been pretty effective and amazing for individuals. Yeah, fascinating to see how individuals modify things to deliver a modality to see if it, because every person's different, right? The way that one person processes trauma and experiences that is going to look different. So there isn't a one size fits all, and just like there isn't one clinician for every individual, I think it's finding the right modality and the right way that it's delivered along with the clinician that resonates with you.
I agree. Well, let's talk about psychedelics. Maybe I'll give you, I've interviewed folks on the podcast and including an organization in Orange County, California. I asked them about that because they work with a lot of veterans. My understanding is the VA has kind of pioneered psychedelics treatment with the veterans because of their trauma. What drew you to the psychedelics? I think you said back in 2016, 2017. What are the outcomes from that treatment, and what are sort of some of the um, regulatory barriers to delivering that treatment? Is California kind of embracing it? How's that going?
Yeah, so in California, our only legal psychedelic that we can use, which is a non classical psychedelic, would be ketamine. And so that's what I began working with in 2016. I had a client, he had severe depression, had tried multiple medications. We'd been doing a lot of work. I had sent him to rehab for alcohol substance use. And over a 3 week period of time, started noticing I had a very different person in my office. And I thought this was really curious because I know I'm a good therapist, but I also was like, there was like a remarkable difference. Depression seemed to be falling off of him. And so at that point, I inquired and I said, I'm noticing in the last 3 weeks, you've just made really big strides. You have new insights. Your depression feels like it's falling off of you. What do you think is shifting for you? And he got really quiet. He was looking down at the ground, which is always a sign to a therapist, like, I'm not sure I want to tell you because I'm not sure what
Mhm.
you'll think. And I was just reminded him, remember, safe space. And he's like, well, I did a thing. And I was like, oh, okay, great. Well, seems like it's helping. He's like, yeah. I'm like, well, do you think you can tell me about it? He's like, well, I went and did some ketamine. I think my eyes must have bugged out because
Mhm.
I was like, oh my gosh, I just sent this person to rehab for alcohol, and now I'm going to have to send them to rehab for ketamine. Because when I was in high school, ketamine was a party drug, it was a horse tranquilizer. What is happening? Has he gone into the K hole? And how has this helped? He
Mhm.
very quickly was like, no, 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 it's a medical treatment. And I was like, he's like, yeah, my psychiatrist sent me to his buddy. He has this IV clinic out in Santa Monica. And I was like, wow, well, it seems like it's been helpful. And he's like, yes, right? And he just went, ba, 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 telling me everything about it and was like, oh my goodness. He leaves. I go to the computer and I start deep diving. And I'm like, wow, wow.
Mm.
I'm just uncovering article after article and seeing everything. And I'm like, I got to find out about this. So I called the ketamine clinic where he was going and I said, hey, my client's coming there. Could I come with him? I want to learn about this. And so that started my journey, was just seeing him. And then I took a client to the ketamine clinic and I took another client and I took another client. And what I was seeing is not only were they finding freedom from the trauma, they were getting unstuck. Their depression was lifting off of them. Suicide ideation was going away. That over a period of time, they actually were able to decrease their psychotropic drugs, and many of them got off their psychotropic drugs. So I was like, oh, there's something here. So
Wow.
I did a training actually through Colorado, the Integrative Psychiatric Institute, who's like the foremost trainer now for psychedelic medicine. I did a year-long fellowship with them, intense, 3 to 4 hours a week. And at the end of the year, you had to take a big certification exam. Felt like I had gone to double grad school with a little bit of medical school, because we learned all the mechanism action and the science behind it, and proper dosing. But I also learned about all the other medicines that are out there: ayahuasca, psilocybin, 5-MeO DMT, LSD. And so through that, I was like, well, how do I work with these other medicines? I can only in California work with ketamine. So I became licensed in Oregon, because Oregon was the first state to decriminalize and create facilities for psilocybin. So I can go up to
It's still
Oregon and work.
therapy assisted though, right? It's
It's
not
therapy assisted.
legalized for
Yeah.
recreational use.
Correct. It's in facilities, certified facilities. So we do
Okay.
retreats up there. And then I have a retreat center down in Cancun, Mexico, where I work with 5-MeO DMT, psilocybin, ayahuasca, San Pedro, which is mescaline based. And so we'll go down there usually about every other month and work with those medicines down there. But it really has been life changing to see how individuals are able to really recover and let go of the trauma in a different way. So if someone's stuck, I've done EMDR, I've done brain spotting. We've worked on, reducing neuroinflammation in the brain. Then we'll work with ketamine. And once we've worked with ketamine and they're off their psychotropic drugs, I'll then take them to a medicine retreat. Not for everyone. Not everyone needs to do psychedelics, but it can be pretty life changing for those where they are stuck or they're just not moving through mental health.
Well, that's actually a good point. What qualifies a patient to be a good candidate for psychedelic treatment? Is there like what puts them in that category, or like they're a good candidate?
Right. So with ketamine, we have a little less restrictions as far as they can still be on antidepressants, any psychotropic medication to go to ketamine. They need to not have diabetes, uncontrolled hypertension, uncontrolled thyroid disorders. They not any recent cardiac surgery, no poor adverse reactions to anesthesia. And so we look at that to make sure that medically they're cleared. And I have a nurse practitioner and psychiatrists that we work with that will medically clear them, make sure their heart is good, because psychedelics can raise blood pressure. So we want to make sure someone's heart is actually really good to be
Hmm.
able to withstand that. So we can work with ketamine with individuals who are still on any type of psychotropic drugs. Again, if they're feeling stuck, we can't seem to get them to move through negative beliefs. We've done EMDR, we've done brain spotting, the trauma's just not letting go, or they just can't let go of guilt or grief or anger and resentments, and they're just really plagued by these beliefs, negative beliefs about self. And so then we'll go to psychedelics to allow for some flexibility. If I'm going to work with something like plant medicine, it's really, really, really important, because as we start to see more and more people accessing these medicines, people need to know that there's probably a list of 100 different medications that someone cannot have taken within 10 days of working with many of the plant medicines, and some of them within 20 days, because they can actually cause a very severe reaction of serotonin syndrome. And so It's really important individuals that are out there curious in psychedelics, if they think they're going to do this recreationally, you really need to understand there is a great long list of medications you cannot take because you can have it very adverse and it could be fatal in some situations. So we go through very intense screening, really making sure like what medications is an individual on, and then we have to work to taper them off those medications. So especially psychotropic drugs. You cannot be on psychotropic drugs for at least 10 days if we're going to do ayahuasca for 20 days beforehand. And so we really have to work with their medical practitioner to make sure they're off those medicines.
Got it. Okay. And what surprised you the most about patients that use the psychedelic integration in therapy? Is there like a specific case where somebody was really suffering from a specific ailment and they went through it and it was kind of groundbreaking?
Yeah, I mean, there's so many of those stories, so many of those realizations. I think probably some of the biggest ones that I've seen is for individuals has just been grief. Profound grief that losses that they've suffered. There's probably the most transformative experiences, almost mystical for some of those individuals where they feel like they have an encounter with the lost loved one
Mm,
or lost parts of self. I mean, grief isn't always just about death. Grief can be about, realizing I let go of a part of myself, maybe in my 20s, something that was really important. And I kind of bear this burden of grief, or, a relationship ended, and I can't seem to move past through the grief of this relationship. And I keep thinking about this person. They're no longer going to be in a relationship with me, but I can't get beyond it. And so they a lot of times will have a conversation in that medicine experience. And then afterwards, the most important part about psychedelics, you can have the experience, you can have the journey, the trip, whatever you want to call it. But afterwards is what do I do with the material and the realizations that came up, the felt sense that I experienced in that medicine. I really need to work with that. And those realizations, I've had individuals that finally realize what their medicine experience meant to them, but it could be a year later, year and a half later, 2 years
mm,
later, they encounter and go like, oh, I remember what came up in my medicine session and now it makes sense to me why that information came up. And so integration becomes important. So again, individuals recreationally exploring psychedelics, it's really important to understand if you did that on your own, go work with a therapist trained in psychedelics or a coach. There's a lot of coaches out there that do this work as well to help you unpack and make sense of that information. How do I apply that to my life?
got it. And I want to ask you about the two books that you wrote, but one last question on the psychedelics. Why do you think there's so much pushback with so much evidence? I could be wrong about this, but I think there's been 50 plus years worth of research on this. It's been proven over and over that it works. Professionals like you have used it extensively, successfully, multiple different use cases. Why do you think there's so much stigma around it? And I know there's kind of a push and pull. This is why I said the recreational side of things, like obviously in Colorado, marijuana is legal, and there's a whole debate here around whether it should have been. And in the case of psychedelics, there's often this conversation about, oh, they just want to make it legal because they want people to get wasted, right? And I've always kind of leaned on the side of it's got to be managed in therapy. It can't just be go out and get these on your own. But I guess without getting political, because there's some there's some politicals about it. Why do you think it's still kind of this weird territory that, states haven't evolved and regulations been kind of stuck?
I think there's a couple things. One, psychedelics need to be used responsibly. And so once you decriminalize it, individuals, if they access it, or even if we legalize it, are people going to know to use it responsibly and carefully, and be in safe environments? So I think you've got that aspect that is of concern. And also, like I said, a lot of people don't realize, like, there's some real contraindications to possibly taking these medicines. And so there's safety concerns that are there. The bigger issue I see is, it's $1 billion business, pharmaceuticals. And if we're talking about something that can actually heal the mind and change someone's mind where they don't need a psychotropic drug, that's $1 billion business. Why am I going to allow for that to happen? I'm going to put every scare tactic out there as possible. And in fact, I think that this is really what happened when the war on drugs came. the pharmaceutical companies very quickly, and they're not going to like me saying this, and I probably put a target on my back every time I say this, but the pharmaceutical companies were like, you know what, this war on drugs, let's just conveniently get psychedelics put in there. Yeah, we want cocaine off the streets, we want meth off the streets, but hey, let's get those psychotropic altering medications out of there so that people keep buying our drugs.
Yeah.
$1 billion business. People are lifelong on these drugs. And look, they're not getting better. We are sicker than ever in the United States. There is an unbelievable rise on suicides and individuals struggling with mental health disorders. If these drugs were so impactful, we should be golden today. No one should be walking around with depression and anxiety. Suicide risks should
Combined with the
be
overprescription of drugs, right? That's a whole
so
different problem. That's probably a subset of the
absolutely,
same problem.
absolutely, absolutely. So it's $1 billion business. So it's going to be blocked over and over and over again until enough people scream and say, this is not right. I got better. Other people should get better. We need to have access to these medicines.
Yeah, it's unfortunate that it works that way. Let's talk about the books you wrote. So you wrote two best-selling mindfulness books for teens
Mhm.
specifically, and tell us what inspired you to focus on this this age group, and what impact have you seen it make in young people's lives?
Yeah. Yeah, so I was working on a high school campus and working with a lot of teens that were struggling. And along the way, had learned about mindfulness just as a great practice for my own self. It just helped reduce stress so much for me. And I also noticed that my concentration was better. And this was in the midst of grad school. I was finding that once I adopt a mindfulness practice, daily practice, I found oh, wow, I'm actually retaining information actually better. I feel like I'm writing my papers faster. And so I had remembered this. And as I was working with teenagers, they were complaining about all the homework and tests and all this kind of thing. And I said, there's this really great technique called mindfulness. And it's shown that in 30 days, our brain starts to change and function differently. And you'll probably have better memory. You'll probably test better and you'll probably get your homework done quicker because you'll be able to focus and just get through it quicker. And so you tell a teenager they can get their homework done quicker and maybe score better on their tests. They're like, well, all right, I'll give it a try. And so I just said, let's do a 30-day challenge because this was right when 30-day challenges were so popular on social media. Let's do a 30-day challenge. Let's pick an exercise and you do it every day for 30 days and let's see. Let's just see what happens to your scores. And so they did, and they came back and they're like, hey, this really works. And so over the time that I worked at the high school, I started developing different little mindfulness activities. I put cute names to them like Eat the Frog and Superhero Pose and, you know, um, Tame the Monkey. And so I developed 60 different exercises, morning, midday, evening exercises. So there's something for everyone. And, I think it's fun because I've had a lot of teens and their parents pick an exercise or two and they'll just work on them together with each other. And I said 10 minutes a day, but, really a practice of 2 to 3 minutes of mindfulness, it can be just as impactful. I just find that if you can do 10 minutes, we actually see if we were to test someone's blood, we would see the cortisol levels start to dramatically decrease in their system if they're doing 10 minutes of mindfulness a day. But the benefits of mindfulness can be received in 2 to 3 minutes a day.
I started doing 10 minutes a day with this app called Waking Up. I don't know if you've heard of
Mm-hmm.
it.
Mm-hmm.
Sam Harris is behind it. He narrates it. I think I've been doing it, I would say on and off because I'm not as diligent as most people in doing it every single day. I think I would say I'll skip a day or two a week, but the difference is astounding.
Mm-hmm.
I mean, I'll go into my day, like you said, so much more focused. Like I can kind of handle a much wider bandwidth of work with that same self just by being able to breathe through different parts of my work when I switch from one thing to another, because it's not just a 10-minute meditation. It teaches you more than
Yeah.
that. And
Yeah.
it's been like groundbreaking for me. Another thing that my wife and I talk about a lot, because she's been doing meditation for many years. And it's something that, I think as a guy, because men tend to be less open to this kind of
Hmm.
exercise. In the beginning, I was like, all right, but how much change can that make? Me sitting silent for 10
Hmm.
minutes thinking about, and it does make a huge change. So, and I imagine with teenagers, that's got to be a much more impactful experience, because I'm 44 years old. I know who I am. I
Hmm.
kind of can manage my own. But if you're, in your teenage years and you're in school and all of the things that happen there in social media and how that's playing a role in your becoming an adult, that's got to be even more impactful for them, right?
Oh, yeah, absolutely. 100%. I've seen just such a difference in confidence levels, feeling more self assured, feeling like they're finding their voice in a different way. There's a steadiness that starts to come. Anxiety starts to reduce, depression starts to lift. And also, I think there's the piece of when you realize like my focus is better, I'm able to get the things done that I want to get done. I also tolerate emotions in a different way. So distress tolerance to difficult emotions is different. And so, just has so many different improvements in their lives and helps them to be less judgmental of themselves. I mean, look, they're faced with social media is there and all this information that's coming in. And many times the teens start to have a very negative dialogue about self. And so through
Comparing
mindfulness,
themselves with others.
absolutely, comparing themselves, judging themselves to others. And mindfulness is all about being non judgmental. And so that practice really just is just such a powerful practice for a teen to learn to be less judgmental of oneself, to be more accepting of oneself, to love oneself deeper, and to have appreciation for their friends and their family in a different way.
And while we're in the subject of mindfulness, I think this might be associated. As someone who runs a clinical team, what advice do you give to your therapists about preventing burnout and staying grounded in the work that they do? Because it's kind of the same, right? You can't have the people that are showing people the ropes be on the other side of the equation.
Yeah, absolutely. We have a team meeting every Friday, and every Friday we start that team meeting with a 5 to 10 minute mindful meditation. And it really is very helpful and impactful for all of us as we're collaborating together and talking about more difficult cases so that we're not emotionally burdened and weighed down and we don't run into burnout. And so we really support each other in that practice. So it is so impactful, and it helps us also recognize that the client's struggles are their struggles while we're there along to walk alongside them. We don't need to insert those into our experience, and that we can be mindfully aware of their experience is their experience, and we're helping them work through their experience and just, feel a little more calm, a little bit more at peace, and know that there's a time and place. I'm not sitting with this client right now. I know they're safe. I know I gave them good tools and resources. I'm not sitting with them. I don't need to sit here and ruminate about what's going on with them. I can thoughtfully set that aside. And when I need to pull out and take a look at that client and their information and maybe conceptualize where am I going with their treatment plan, I can do that, but then I can put that down and I can move on to something else in my day.
Very cool. I guess for somebody listening to this podcast now, who's just kind of beginning their journey or their healing journey, what would be one practice or mindset that can help them get started today? What would be one thing, maybe meditation or something that because I think, at least for me, the hardest part, it's kind of like going to the gym. It's hard to go those first couple times. But
Mm-hmm.
then when you start getting results, like, oh man, I want to go more. And so I think it's very similar to what we're talking about. So what's one thing that you would recommend somebody does from a practice or mindset perspective to get started today?
Yeah, I think a really simple practice that we can all adapt into our day because we have to do it anyways is be mindful when we're brushing our teeth. Rather than thinking about all the things that I'm going to have to get to today, all and starting the stress wheel off as we're brushing our teeth, just be mindful in that practice. It's 2 minutes. Most of us have electric toothbrushes at this point. I guess not everyone does, but we're supposed to brush our teeth for 2 minutes. So 2 minutes, we can all stay mindful for 2 minutes and really notice that I brush each teeth. Your dentist is going to love this. Not only that, because you're going to be so mindful of practicing. Oh, I got every tooth. I really got that well. Add flossing in on top of it, you got maybe 3 or 4 minutes of mindfulness, but really noticing the texture of that toothbrush, the taste of the toothpaste, the sound of the toothbrush going against. Just being mindful in that actually starts to set the mind off in that direction to be focused in whatever I'm going to be doing that day. We have to brush our teeth anyways, or we should be brushing our teeth anyways. So start your mindfulness practice with that, and you're going to be far better off in starting your day because you haven't started the stress wheel right off.
And
Brush your
it's
teeth.
funny you mentioned that because I recently bought a new toothbrush and they do have a 2 minute timer.
Mm-hmm.
So when you press the button, it'll
Yeah,
time out after 2 minutes so you know it's over. And that is as easy as it gets in getting started. And you
easy.
mentioned, yeah, for somebody who hasn't meditated before, you mentioned, the texture of the teeth and kind of like where you're moving. That is the essence of meditation, right? I mean,
Yes,
if you can get started with that, and then you can it'll be an easy change when you actually start practicing
yes.
that too.
Absolutely. And then once you get that practice down, I say, like, the other one that I love to do is put your toothbrush down and do a little power posing. You just stand like that superhero. You look yourself in the mirror and you say, I can be calm and confident today. I can handle my
Mm,
day with grace. You know, give yourself a little positive affirmation. Start off your day like a superhero.
that's awesome. I love that. Well, Jenny, we talked about a ton of different things. I think we could probably go off and spend, maybe record another podcast for an hour or two because I can go off on a million different tangents about what we talked about. What I'd like to close our podcast with are two questions. First, I always like to ask people what they would be or how they would see themselves if they weren't doing what they're doing. So, to give an example, and people make fun of me, but if I wasn't running this software company, I'd probably want to be like an airline pilot, which has nothing to do with what I do. That's just what I might be if I didn't do this. Can you think of a different version of you where you'd be doing something else, maybe like a passion that you've had that you potentially could be doing if you weren't doing what you do?
Yeah. If I wasn't a therapist, I think I'd want to be a pro dancer on Dancing with the Stars. Because when I was a kid, my parents put me in cotillion and I loved ballroom dancing.
Wow, interesting. And it's funny that pretty much without fail, when I ask somebody that question, it is almost never related to what they do. It's completely unrelated. I think I had one person we interviewed a couple weeks ago, and he said, "I can't think of anything. I'd want to be a therapist. That's it. I don't know. I haven't thought about it. This is the only thing I want to be." And the second question I want to ask is first, if you can give us the title of both of your books that you wrote. And then if you could recommend any books or podcasts or anything that you're listening to that you would recommend to the audience that they would listen to.
Yeah, so my books are Mindfulness for Teens in 10 minutes a day. And those have 60 simple practices that we can integrate into our day. And then I have the Mindfulness for Teens journal, which is a nice, thoughtful way to kind of think about mindfulness in a different way with fun little prompts to get us thinking about mindfulness. And oh my gosh, there are so many books that I'm reading that I'm loving.
Are
The
you one of
book that
those
I'm
people who read like 5 books at a time?
Oh, absolutely, absolutely. I'll show the book that I actually have a book that's on my desk right now. This is The Queen's Path. This was written by my colleague that works with me here at my office, Dr. Stacy Simmons, and this is about helping women shed the narratives that we were given as little girls of either you be the good girl or you're the bad girl, and how to really find our voice and to feel empowered and find sovereignty. It has a 13-step transformational process. And we actually do our retreats based off of this book, really helping women feel powerful in themselves while balancing life, relationships, with shedding the narratives that were put on us as women, as little girls, often.
Very cool. Well, Jenny, thank you so much for being here today. I enjoyed our conversation. I'm sure everyone listening to this is going to as well. We appreciate you being here and sharing all the insights and your experience. Thank you so much.